Hello everyone, this is Dr. Kant Shah here, Pediatric Robotic and Laparoscopic Surgeon. This is part 2 of the video on pyeloplasty. We have already talked about the technique. Now let's talk about some more details such as complications, etc. in this video. When we do a pyeloplasty, we also put a stent. What is a stent? It is a soft silicone tube which is placed from the kidney draining into the bladder to help the urine flow across this newly constructed PU junction. Why? Because there will be some swelling. We are talking about millimeters of tissue here, and any swelling may disrupt this tissue if the urine is not flowing freely. And any pressure of urine not being able to flow freely through this junction may disrupt this newly formed pelvic junction, and hence most surgeons put a stent across this pyeloplasty. This stent is removed 1 month later, sometimes earlier or later, by a procedure called cystoscopy, which roughly takes about 10 minutes under anesthesia. So what is a stentless pyeloplasty? A stentless pyeloplasty is a surgery done without placing a stent, and it is only suitable for select cases. It avoids a second procedure for stent removal, and this decision is usually taken during surgery. Most surgeons such as me do not prefer stentless pyeloplasty. The stent is used to support healing of the pelvic ureteric junction and avoids the insertion of nephrostomy, which is a tube in the kidney, and this we feel is a better option than doing a stentless pyeloplasty. So once the pyeloplasty is done, what should the parents expect from the recovery point? Most children will start feeding on the same day after surgery within 3 to 4 hours, and by the next day they should be perfectly mobile in the hospital. We would prefer them to get IV antibiotics and IV fluids as required, and hence 3 to 5 days of hospital stay is required. A follow-up imaging is done 1 month after pyeloplasty before removing the stent to confirm that there is no leakage and the surgery is successful. One of the most common questions that parents are worried about is what are the complications of this surgery. Complications of pyeloplasty commonly are two: a leakage across the pelvic ureteric junction, and hence to mitigate this we put a stent, and the second complication is a repeat narrowing of the newly formed junction called a stricture. A repeat narrowing usually occurs after a leak, or it could even happen if the primary tissues where we operated were not good enough to have a healthy and wide anastomosis. A stricture can sometimes be mitigated by just putting a stent again, and it usually solves the problem in 4 out of 5 children. However, once in a while there is a child where the pyeloplasty has failed, and that child will need a redo pyeloplasty. If the anatomy is favorable, the outcomes of redo pyeloplasty are as good as the pyeloplasty in the first instance. Now, sometimes the tissues are not good enough, and other measures may be taken to drain the urine from the kidney into the ureter. In summary, a pyeloplasty is a very well established surgery in children. For the last few years, almost all children at our center undergo laparoscopic or robotic pyeloplasty. Such modern techniques are safe and effective in children, and the goal is always long-term kidney health. Every child is different, and an individualized approach is required. And finally, long-term follow-up is essential after a pyeloplasty. If you have more questions, then please write them down in the comment section. There are more videos coming on this topic. Please watch out for them. And please like and subscribe.